Good.
Mm-hmm.
My name's Taylor, and this is my head to toe assessment. We're going to scan the room first. Lizzie is my patient. The room is clear of objects besides what we need. Riley is recording. I'm going to go ahead and not do my 1 minute dump, and I'm going to get started in 1, 2, 3. Okay. Hi, my name's Taylor. I'm going to be your student nurse today. I'm going to go ahead and provide for privacy, and I'm going to perform hand hygiene. Can you tell me your first and last name and your date of birth, please?
Lizzie Ryder, January 5th, 2007.
Great. Do you have any allergies I should be aware of?
Nope.
Okay, no allergies. Great. Before we get started, I'm just going to go ahead and check my provider orders.
Oh, I threw them on the bed.
Oh, perfect. Okay. So I'm checking your provider orders. It looks like we have a head to toe assessment. So that literally means I'm going to be starting at your head and working my way down your body. I'm going to be inspecting different things, listening to things with my stethoscope. I might be palpating certain areas for things like edema or masses or tenderness or deformities. And I'm also going to be taking your vital signs and having you perform some range of motion exercises and testing your muscles. Is it okay if we do that today? Great. I do not need PPE for this assessment. So next what I'm going to do is I'm going to gather my equipment, which I have all my equipment here. I have my stethoscope, my blood pressure cuff, my thermometer, alcohol wipes, tongue depressor, cotton ball, paper, and pencil to write down my vitals. I also have the otoscope over there, which I can't grab, so it's going to stay there, but I'll use it when it's time. I'm going to go ahead and cleanse my equipment, and then I'm going to ask my patients some questions to make sure they're ready. So, Lizzie, before we get started, do you need to use the bathroom? Do you need your glasses or your hearing aids? A drink at all?
Nope, not today.
Okay, great. Are you in a comfortable position?
Yep.
Awesome. Do you have any concerns before we begin today?
Nope.
Okay. And then I'm going to go ahead and ask you a couple of questions. So, do you have a history of smoking?
Nope.
I said smoking there. Sorry, that was a little bit loud when I opened that cuff. And she said no. Do you have any pain that you notice when you're doing any of your daily living activities?
Nope.
No? Okay. And then do you have a history of edema at all?
Mm-hmm.
Okay, great. So now that I'm done asking those questions, here in a second when I'm done cleansing my equipment, we'll get started with our general survey, which I'm going to say we're good. I cleansed all our equipment. So I'm going to get started with my general survey. So first what I'm going to do is I'm going to start by looking at, I don't want to start by doing that. I'm going to ask you a couple of questions about your orientation first. So can you tell me what your name is?
Lizzie Ryder,
And then where are you today?
Southwest today.
Great. And then what are you doing here today?
I'm here for a head to toe assessment.
Okay. And then what's the date?
October 21st, 2025.
Great. Now I'm going to go ahead and I'm going to assess your appearance. So I'm looking at your mood. So far, your mood is good. Your facial expressions are happy, which makes me think that you're in a good mood and not experiencing any pain. I'm also noticing your personal hygiene is really good. Your clothes are clean and neat, and there's no odor that I'm noticing. And your speech is good so far from our conversation. I'm going to check your posture. So your anterior posture looks good. Your posterior posture looks good. No kyphosis, scoliosis, or lordosis. I'm also going to go ahead and I'm going to take your vital signs now. So I'm going to start with your blood pressure first just to get you ready because we have to wait a little bit in between. I'm just going to move some things out of the way and use a pillow. Lift your feet for me, please. Okay, your arm is at heart level, which is good. I'm going to go ahead and put the cuff on. Oops. I'm just going to move that way. Sorry about that. Okay. Probably shouldn't have put a sweatshirt on there, Lizzie. Just saying.
I'm your patient.
I'm going to make you take it off later. Because
Yeah, that's fine.
Okay, it fits well, which is good. Now I'm going to go ahead and feel your pulse. And I'm going to pump this up until I can no longer feel your pulse. You might feel a little bit of pressure. 100. So we're going to go down. I'm going to let your arm rest for 1 to 2 minutes. And while I do that, I'm going to take your other vitals. So I'm going to start with your pulse. I'm going to take it for a full minute, starting now. Sorry, my stomach is running. Me too. Okay, done with that. So your pulse, I took your pulse and your respirations. So your pulse was 68 and your respirations were 13, which I just doubled your respirations. And I did the same for your pulse, so that way you didn't know I was doing it. Now that I'm done doing that, I'm gonna go ahead and take your temperature and then we will get your blood pressure. I'm gonna have you open your mouth, put your tongue up, okay, put your tongue down. Just takes a second, so just give me a minute, okay? Okay, 97.7, which is within the normal range, which is good.
That's good.
It is good.
We're all 97.
Okay, now that I'm done with that, I'm gonna go ahead and take that blood pressure. Making sure I'm using the diaphragm. Gonna palpate for your brachial pulse. Can you extend your arm for me a little? Makes it a little bit easier. It's right there. So I'm gonna place it here, making sure it's not touching the cup. And I'm gonna go ahead and inflate this to 130. Okay, you might feel some pressure. Okay. Okay, it was 92/70, which is normal. So the blood pressure ranges, I'm gonna write that down really quickly, 92/70. Okay, so the blood pressure ranges, a normal blood pressure range is systolic 120 or under and diastolic 80 or under. I'm just gonna set that there for now. Elevated blood pressure is systolic 120 to 129 and diastolic 80 or above, or no, 80. And then stage 1 hypertension, systolic is 130 to 139 and diastolic is 80 to 89. And then hypertension stage 2, systolic is 140 or above and diastolic is 90 or above. And then hypertension's emergency, systolic is 180 or above and diastolic is 120 or above. So you're within the normal range, which is good. Open, your temperature is 97.7. Okay, now that I'm done doing that, I'm gonna just move that to the side. I'm done with your respirations. I'm gonna move on to your skin. So first I'm gonna check your skin, inspect it for color, for lesions, bruising, rashes. Lesions, bruising, rashes, and color, yes. So I'm just gonna look at your skin, great. And also look at your legs. I'm just gonna have you roll up your leggings. You can leave those up for a while because I'm gonna have to inspect your legs again later. Okay, coloring looks good. No lesions, bruises, or rashes. For lesions, I'm going to state the mnemonic. So A is for asymmetry, B is for border irregularity, C is for characteristics, or color, not characteristics, color. D is for diameter, and E is for evolving. Now I'm going to go ahead and palpate your skin. So I'm palpating for texture, temperature, and eventually I'll do turgor here in a little bit. Your color is good. Your temperature is warm. The texture is not dry. It's smooth. And then I'm going to test your turgor by pinching your arms, your hands a little. Sure the turgor looks good. Now that I'm done with that, I'm going to go ahead and check your nail beds. So I'm checking your nail beds for shape, contour, and coloring. And the coloring is good. Your shape is good, and so is the contour. And same with your feet. Everything looks good there for coloring, contour, and shape as well. Now I'm going to move on to your head. So for your head, I'm going to first start with symmetry of your face, and I'm going to start with your expression. So can you go tease? Great, sorry, or smile. Your symmetry is good, and so is your expression. Now what I'm going to do is I'm going to go ahead and do the light sensation touch test with you. So I'm going to have you close your eyes, and every time you feel the sensation on your face, please say yes.
Yep. 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 Yep.
Great, you can open your eyes. Now I'm going to go ahead and look at the shape of your head, the symmetry, and the size, and it all looks good to me. And I'm going to go ahead and palpate your head for masses and tenderness. Are you feeling any tenderness?
Nope.
Okay, that completes the head. I'm going to go ahead and move on to your eyes. So for your eyes, I'm going to go ahead. Oops, I forgot to sanitize this pen light. I'm going to do that really quick before I use it. It's kind of under all my supplies. I'm going to set this back here so don't forget about it. Okay, now that I have my pen light, I'm going to go ahead and look at your pupils first, which is the black part of your eye. So I'm looking for shape, symmetry, and color. So it's black, the shape is good, and so is the symmetry. I'm next going to look at your irises for the same things, shape, color, and symmetry. Your irises are brown colored. Your shape and symmetry are good between both of your eyes. Now I'm going to have you close your eyes for me. I'm going to check your eyelids for lid lag, lesions, and edema, which I'm not noticing any. You can open your eyes. I'm going to check your conjunctiva, so pull down your eyes for me. For color and moisture, it's pink and lots of moisture, which is good. You can put them back up. Next, I'm going to check your sclera, which is the white part of your eye. I'm just going to shine my light a little. I'm looking at color and lesions and moisture, and they look good. No lesions. The moisture is good, and the coloring is white. Maybe a little bit of redness, but that's not bad. It's normal. Now that I'm done doing that, I'm going to go ahead and get started with our pupil reactions. So I'm going to have you just keep your eyes open. I'm going to shine this light in them to see your pupils constrict and dilate. Okay, great. And now I'm going to do pupil accommodation. So I need you to track this pen as I bring it close to your face with both of your eyes, okay? Follow it with both of your eyes. Great. Now that I'm done with that, we're going to do our 6 extraocular movements. So again, just follow my pen with your eyes. Great job. Awesome. Now I'm going to go ahead and put this down. We're going to test your sight or vision. Can you read this line for me?
Alcohol prep pad.
Great. And then lastly, what I'm going to do is I'm going to palpate your globes for tenderness. So close those eyes and masses. Any tenderness at all?
Nope.
Okay, sorry if my hands are cold. I'm done with that. So next I'm going to move on to your ears. So for your ears, I'm going to go ahead and first check the external ear, both ears. I'm looking for color. I'm looking for lesions, scars, any foreign bodies, cerumen, swelling, redness, which I'm not noticing any of those. The color is pink. There's no cerumen. The symmetry, shape, and size of your ear looks good on that side. And it does look good on this side as well. I am noticing that you have 2 piercings, 1 on each ear, which is normal. No cerumen present, no lesions, scars, or foreign bodies. So nothing concerning, no swelling. Now I'm going to go ahead and apply pressure to your ears. So I'm going to pull the pinna back, the targus. Just going to fold your ears. Any tenderness?
Nope.
Okay. And now I'm going to palpate your mastoid as well for tenderness. Any tenderness?
Mm-mm.
Okay, good. Now that I'm done with that, I'm going to be looking inside your internal ear. But before we do that, I'm going to do the whisper test just to get it out of the way because I'm going to forget it if I don't do it now. Okay, so I'm going to whisper to you. I'm going to say 3 words, and I want you to, if you can hear them, say them back, okay?
Blue, red, white.
Good job. Pink sprinkled cupcakes.
These sprinkle cupcakes. Hey,
Great.
I'm hungry. Don't make me hungry.
Okay, she did great with that test, so now we're going to come on over. I'm going to move my book bags that I shouldn't have put on the chair. Like I said, we couldn't bring the otoscope over there, so here it is. It's been sanitized.
It's fine.
I'm going to go ahead and look inside your ear. Before I do, for an adult, I would pull up and back. For a child, it's down and back. I'm going to go ahead and peek in your ear. Let me know if you feel any tenderness when I put this in here. Lizzie, you can't move.
Don't put it too far.
I'm not. Oh, does it hurt?
Just a little.
Okay, I am actually noticing a little bit of cerumen, no redness or swelling. I'm noticing a lot of actually a lot of cerumen. That's normal. No swelling, no foreign bodies. I'm looking at the tympanic membrane right now. It is a pearly gray. It is not flat, bulging, or retracted, which is good. Okay, now I'm going to have you turn. Same thing on the other side, so up and back. Oh, that's right. You learned this trick. How to hold it. Lizzie, stop laughing.
It hurts.
It
You're
does?
putting it really far in.
I'm not, though. Okay, I'll pull it out a little. Sorry, patient Lizzie.
It's okay.
Must be quiet. Okay. Okay. Good learning experience, because sometimes you do stick it in too far and you need to pull it out a little. Happens to the best of us, and it's important to listen to your patient. Okay, she's my sister for reference. Anyways, I'm noticing no redness or swelling. I'm also noticing a little bit of cerumen, but not a lot. And no foreign bodies. I'm going to go ahead and look at that tympanic membrane. It is gray and pearly gray, which is good, and it's not flat, bulging, or retracted, which is good. Sorry. Okay, now that I'm done with that, we're going to go back to the bed.
It's just very, very cool.
I cannot believe you right now.
It actually did hurt though.
Okay.
I wasn't making
You're-
that
you're-
up.
Okay, I'm sorry. We're moving on. Sorry about that. Okay, now that I'm done with that, I'm going to check your nose next. So I'm going to look at your external nose first. I'm looking at the color, discharge, or drainage. Same thing pretty much. I'm looking for any deformities, lesions, scars, and I'm looking for the shape and symmetry as well, which it looks good. The coloring is normal and no lesions or scars are noted or drainage. I'm going to go ahead and check your external nose canals out now for color, drainage, deviations, and polyps, which no deviations and polyps. The coloring is pink and very minimal drainage, but that's normal. Now that I'm done with that, I'm going to go ahead and palpate your external nose for, tenderness and deformities and masses. Does anything feel okay? Now I'm going to palpate your maxillary and frontal sinuses for tenderness and masses. Any tenderness?
Nope.
Okay. And now that I'm done with that, we're going to do your smell test. So I'm going to have you close your eyes. Great. Plug one nostril. What do you smell?
An alcohol wipe.
Okay, other side. What do you smell?
An alcohol wipe.
Great job.
Kind of smells like nail polish.
Yeah, probably a little bit. Okay, now that I'm done with that, I'm going to go ahead and move to your mouth. So now I'm checking your lips for cracking, color, moisture, and lesions, which no lesions, maybe a little bit of a crack in the middle of your bottom lip. It's that time of year where people are getting dry, so I'm sure that's part of it. And moisture still looks good though, even with that crack. And the color is normal, pinkish color, which is good. Now I'm going to have you say ah. I'm going to check out a couple things. Your buccal mucosa, the color is good and the moisture is good. Your tongue, the position, color, and moisture is good for your tongue as well. Can you say light, tight, dynamite?
Light, tight dynamite.
Okay, I'm sorry. I'm going to have you say ah again. Checking out that hard and soft palate, which is intact. Can you stick your tongue out and say ah? I see your uvula. It's midline, which is good, and it vibrates when you said ah. And I also checked out your tonsils while I was looking in there. They're a normal size. There's no exudate on them, which is good. Now what I'm going to do is have you move your lips a little so I can see your gums. Great. Checking your gums for color, edema, retractions, and bleeding, which I'm not noticing any of those, and the color is pink, which is good. Now that I'm done with that, I'm going to tell you what I would do for a couple of things. So for palpating the hard and soft palate, I would use a gloved finger for an adult, and for an infant, I would use a gloved pinky. We're not going to do that today. And then for a gag reflex, you would use a tongue depressor. you would stick it on the tongue and push it back until it initiates your gag reflex, which we are also not going to do that today. So now that I am done with that, I'm going to go ahead and move on to your neck. So I'm checking your neck for size, well actually not size, for symmetry and range of motion, which your symmetry looks good. Can you move your head side to side for me? Great. Can you do a rotation? Awesome. Okay, did that hurt at all while you were doing that?
Nope.
Okay, I'm going to check next for jugular vein distension. So I'm going to have you turn your head. You can lay down. Actually, that would be great. I will put your head up. Thank you.
It's not my nap.
Sorry.
It's okay.
Okay, I'm going to have you turn your head that way. No jugular vein distension. Other way. Great. Now I'm going to go ahead and have you turn back that way. I'm going to palpate, for your carotid artery. Or pulse. Sorry. There it is. Okay, other side. Great. Okay, now I'm going to listen. And when I listen, I need you to take a deep breath and not breathe because that can interfere with me hearing it. I'm going to use the bell of my stethoscope and I'm listening for breaths. Okay. Hold your breath. Okay, other side. You can take a breath. Okay, hold your breath. Okay, great. No brutes were detected when I was listening to it, which is good. You can go ahead and swing your legs back over and bring your head back down so it's flat for you again. Okay, now that I'm done with that, I'm going to go ahead and palpate those lymph nodes. So preocular, postocular, occipital, tonsillar, submandibular, submental, superior, anterior, cervical, deep cervical, posterior cervical, and then supraclavicular. Okay, now that I'm done with that, I'm going to go ahead and move on to your, I'm just thinking, give me a second, will you? Okay,
Really?
I'm just going to move on to your respiratory. So for your respiratory, I'm first going to check your posture. So I'm going to check your anterior posture, which looks good. And your posterior posture, I'm checking for lordosis, scoliosis, and kyphosis. And I didn't notice any of that. I'm going to check your lateral ratio, which is 1 to 2, which is the normal ratio. So that's good. Now that I'm done with that, I'm going to go ahead and go to your back and perform a couple of different assessments. So I already checked your posture for your back for lordosis, scoliosis, and kyphosis. Now I'm going to do your chest excursion. So I'm going to put my hands here and I want you to take a deep breath in. Okay, great. Now I'm going to do tactile fermentus. So when I put my hands on your back, say 99.
99, 99, 99, 99.
Great. Now that I'm done with that, I'm going to go ahead to the front and we are going to listen to your anterior lung sounds. Then I'll do your posterior and then I will do your lateral. So anterior is 10 spots, posterior is 12 spots, and then lateral is 3 spots on both sides. And I'm going to use my diaphragm. Okay. Deep breath in. Good job. Deep breath in. Deep breath in. Deep breath in. Okay, deep breath in. Good job. Deep breath in. I'm going to actually go under if that's okay. Deep breath in. Deep breath in. And then last 2. Deep breath in. Deep breath in. Great. Now I'm going to go to your posterior side, which is again 12 spots. Deep breath in. Great job. Deep breath in. Great job. Deep breath in. 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 Okay, and then last couple of spots. Deep breath in. Deep breath in. I lost count, so we're going to do 2 extra ones. Deep breath in. Deep breath in. Okay, we're going to go ahead and listen to your lateral sides now. So I'm going to start on this side. Deep breath in. Great. I'm going to go over to this side. Deep breath in. Okay. Deep breath in. Oops, actually wrong spot. Sorry. Deep breath in. Oh, sorry about that. Deep breath in. Great. And then this is your last spot. Deep breath in. Last spot. 1 second. Deep breath in. Great. Okay, now that I'm done with that, I'm going to go ahead and I'm going to count your respirations for a minute. And I'm going to note the rate, the rhythm, the equality, and then I'm going to note if you have any accessory muscles or retractions in use during your respirations. So I want you to try your best to breathe as normally as you can while I count your respirations. And I'm just going to put my hand on your back. Starting, not yet, I should have started already. Now. Sometimes looking at the chest helps. Okay, I got 16 respirations. Your rate was good, your rhythm was normal as well, and there was no use of accessory muscles or retractions noted, and the equality of your breaths was good as well. So now that I'm done with that, I'm going to go ahead and move on to cardiovascular. Can I ask how much time I've had so far?
You're at almost 28 minutes.
Ooh, okay, I gotta fly. That's why I asked. Okay, let's go. Okay, cardiovascular. So next for cardiovascular, I'm first gonna check your pericardium for wounds, deformities, and scars, which I'm not noticing any of those. I'm gonna palpate it for pulsations, lifts, heaves, and deformities or lesions or masses, and I'm not feeling that. Okay, now that I'm done with that, I'm going to go ahead and I'm going to palpate your body for edema. No edema, 0. So the scale is 0, no edema, 1, 2 millimeters, rapid return, 2 is 4 millimeters, 10 to 15 second return, 3 is 6 millimeters, 1 to 2 minute return, and then 4 is 8 millimeters, 2 to 3 minute return, which no edema. I'm also going to do your capillary refill. Okay, that's good. That's good. I'm also going to be palpating for sensation. Are you feeling my sensation right now?
Yep.
Are you feeling my sensation?
Yep.
And then I also palpated for movement, and I was noticing movement. You have good circulation throughout your body. Now I'm going to go ahead and listen to your different spots on your chest using my diaphragm. Oopsie daisies. Okay, so I'm first going to start with your aortic, which is on the right side at the second intercostal space on the right sternal border. Okay, pulmonic is next, which is on the left side at the left sternal border at the second intercostal space. And this is where I can best hear the S2 sounds as well as with the aortic and pulmonic is S2 sounds, and it is the base of the heart is at the pulmonic. Now I'm going to find your Erb's point, which is at the third intercostal space at the left sternal border, which some people say the base of the heart is actually at Erb's point. And then I'm going to do your fourth intercostal space, which is your tricuspid on the left sternal border. And then lastly, I'm going to find your mitral, which is the fifth intercostal space. Sorry. And it's mid-clavicular. And this is where I would best hear the S1 sound. Perfect. And then I'm going to go ahead and I'm going to listen to your apical pulse for a minute, starting now. Okay, 74 was what I got for your apical pulse, which is within the normal range of 60 to 100, which is good. Everything sounded good. If I was going to finish that, I would have also taken my bell and I would have went throughout all of those spots again, but it wasn't really specified on the sheets, so I just did with my diaphragm. But I would go back and do that and listen to all those spots again, looking and listening for like bruits. Now that I'm done with that, I'm going to go ahead and I'm going to, sorry, I'm just thinking. I'm going to go ahead and just move right into range of motion. I just am thinking for a second, sorry. I'm trying to think. Your abdomen. I'm sorry, could not think about that. I'm just trying to I'm trying my best in this video. Okay. Okay, so first I'm checking the outside of your abdomen. So I'm inspecting it for hair distribution, striae, lesions, scars, color, symmetry, shape, contour, and
I'll put it back.
size as well. I believe I listed them all. And I'm not noticing anything abnormal. Your color is normal, pink, which is good. No striae or hair distribution. No lesions, scars, or wounds. Your symmetry and size and shape is all good for your abdomen. Now that I'm done with that, I'm going to go ahead and I'm going to listen to the different spots, starting at the right lower quadrant, using my diaphragm to listen. Okay, so I'm going to go ahead and listen. Great, now I'm going to take my bell and I'm going to listen to your different vascular points. So your aortic, your renal on the other side, and then your iliac. Great, now that I'm done with that, and also your bowel sounds were active, which is normal. A lot of gurgling, which is normal. I know you said you were hungry, so that makes sense. I'm going to go ahead and palpate your stomach next. I'm feeling for muscle distension, bladder distension, muscular tension, and then I'm feeling for surface characteristics, and then I'm also feeling for, I'm missing one. I just can't think of it. Surface characteristics, muscle, actually, Lizzie, why are you being this way for my video? Okay, now that I'm done feeling all of the quadrants, I felt them for all of those things. I'm going to go ahead and have you stand up, or sit at the side of the bed, and we are going to go ahead and move through our range of motion. Okay, I have 5 minutes, so we're going to fly. Are you ready? Okay, here we go. So first I'm going to do your sternocleidomastoid. So open your mouth, close it, flexion, extension. Good job. Great. Now I'm going to do your cervical spine. So flexion, extension, lateral, lateral, rotation. It's like you already know what you're doing. Okay, go ahead and do that. Flexion, extension, lateral, lateral, rotation. Now your shoulders. Okay, so it's going to go abduction, adduction, flexion, extension, internal rotation, external rotation. Okay, you're going to feel your shoulders and have you do that again. Adduction, adduction, flexion, extension, internal rotation, external rotation. Good job. Okay, now we're going to go ahead and move on to your arms. So it's going to be flexion, extension, supination, pronation. Go ahead. Flexion, extension, supination, pronation. Great. Now we're going to move on to your wrist. So it's going to be flexion, Lizzie, let me do it first. Flexion, extension, rotation. Go ahead. Flexion, extension, rotation. You're going to feel. Okay, great. Your fingers next. Abduction, adduction, and extension. Okay. Abduction, adduction, extension. Great. Now your hips. I'm going to do abduction, adduction, flexion, extension, rotation. Go ahead. Flexion, extension, abduction, adduction, rotation. Next hip. Okay. Adduction, abduction, flexion. Try it again. Flexion, extension, abduction, adduction, rotation.
Okay, yeah.
Okay.
I'm going in order.
Now go ahead and do that again.
This way. There we go.
Flexion, extension, adduct, rotate. Good job. Flexion, extension, adduct. Okay.
Try not to hit
Great.
anything.
Now you can sit down for me. I'm going to do your knees. So bring your knees out, extension, bring them in, flexion. Go ahead. Okay, now for your feet, dorsiflexion, point them up, point them down for plantar flexion, inversion, point them in, eversion, point them out. Okay, go ahead. Great. Now stand up. We're going to do your spine now. So flexion, extension, then I'm going to do lateral, lateral, side to side. Great. Now I'm going to feel your spine while you do that. How much time do I have, Riley?
You have 2 minutes and 40 seconds.
Go, Taylor, go.
Okay.
You're good. You're good.
Sternocleidomastoid, so turn your head side to side. Okay, resistance. Wrong way. Resistance. Okay, now your trapezius. So I'm going to have you, your shoulders, so go up. That's your trapezius. Good job. Oops, inspect it first. Go up. Now, okay. Field goal for your deltoids, so go up. Go up. Okay, good. Now I'm going to do your biceps and triceps, so stop doing it before I do it. I'm going to get points taken off.
Sorry.
Okay, so flexion, extension. Go ahead. Okay, now I'm going to do pressure. Okay, now I'm going to go ahead and move on to your hips. So abduction. Go ahead. Okay, now I'm going to go ahead and, oops, wrong. Sorry. Go ahead. Other hip too. Okay, sit down. Thanks. Now I'm going to do same thing with your quads and hamstrings. So bring your up and in. Yep, and now I'm going to apply pressure. In. Okay, now that I'm done with that, I'm going to go ahead and move on. And I'm going to say the muscle strength weakness. So 5 is normal, 4 is slight weakness, 3 is weakness, 2 is poor range of motion, 1 is severe weakness, and 0 is paralysis. I'm not noticing any of that. Your muscle strength is 5. The equality was good. The symmetry and shape was good as well for all your muscle groups. Now I'm going to ask you some questions. So can you say blue bed sock?
Blue bed sock.
Great. And then what's your name?
Lizzie.
Where are you?
Self-respect.
What are you doing?
Head to toe assessment.
Can you say those 3 words again?
Head to toe assessment.
Can you say those 3 words I told you?
Oh, bed blue sock.
And then who's your 3rd grade teacher?
Mr. Whiteheller.
Okay, stand up for me. We're gonna do 5 to 10 steps for
1, 2, 3,
forward.
4, 5.
Okay, do 'em back.
1, 2, 3, 4, 5.
Okay, close your eyes and touch your nose. Great, with your feet together and touch your nose. Okay, stop. Awesome. You can sit back down. Is there anything else I can do for you today?
Nope.
Okay, I'm gonna make sure the bed is low and locked. Your side rail is up. You have your call light. The side table is by you. The floor is risk-free of falls. And I'm going to document everything according to Schoolology. My skill's complete.